A parent would give anything to see their child truly happy. And by empowering them and showing them how they can respond to their children in a way that's supporting them and responding to their trauma and attachment issues, we can make that connection happen. And it's through that connection with their parents that the child then becomes truly happy. I'm Dr. Aimie Apigian, and I'm a medical doctor and a trauma, attachment, and addiction specialist. I work with adoptive or biological parents who are raising children with defiance or other emotional and behavioral issues as a result of trauma and attachment. And then I work with individuals who are now adults and trying to heal their own trauma and get their health in a better place. I offer one-on-one consultations. I offer group sessions, both with Women's Trauma Group and then the group family experiences where we're doing family camps for groups of families. So attachment trauma is a result of any disruption in the relationship between a mom and her early child, infant at that early stage. And that disruption can happen in several different ways. The most common ways that we can think of are things like adoption, foster care, but there's many other reasons for that disruption to happen. And so for many families, it's that their child had medical trauma when they were early. So maybe their child was born premature, or maybe they had some medical condition that required them to be separated from mom at birth, placed in the NICU for life-saving treatments, but they had that separation that resulted in this underlying mistrust, and their nervous system, their brain, their body's literally wired for survival and stress rather than that of connection and security and safety. So when we know that we are dealing with trauma issues, when that's been identified as some of the core root cause of a person's poor health or poor relationships or poor ability to function overall in life, at a job, whatever it is, when we understand that trauma gets wired into our body and we have these trauma patterns that show up in our health, whether it be chronic pain, migraines, stomach pains, digestive issues, then we can approach it from both a medical, biological approach as well as the emotional and psychological approach. It needs to be both. So what I do when a person comes to me and they're struggling in relationships or with their health is I look for those trauma patterns. Are we dealing with something that has trauma at its root? So whether I'm working with an adult or with a child, we can reverse a lot of those early patterns that get wired into the brain and the nervous system. It's not forever. And yes, it's much easier to do this work when the child's young. The brain is much more neuroplastic. We're able to make those changes very quickly when they still have their mother, and we can work with that relationship. But even if you find yourself as an adult with these trauma patterns and it's showing up in your relationships, it's showing up in your work, your career, your health, we can still do a lot to change that and heal that. Trauma can be so limiting. It can limit a person in the types of relationships that they have. It can affect their ability to even go outside and go to social events. It affects their health. Every area of their life is limited when they're struggling with trauma. And so by doing this work, it all lifts and they become free to live the life that they were meant to live. They have the energy to do that. They have the biology system now that's wired to be able to do this. They have the connection, they have the relationships. All of this comes together when we do this trauma work, and I love seeing that unfold for them and just their life open up for the potential and the hope that they have for a much better future.